Hello, my name is Avi Gupta, and this summer for the John and Violet K Fellowship, I worked on the use of artificial intelligence for classification of chronic wound care infectivity. My mentors were Dr. Delahanty and Dr. Gupta, and my advisor was Dr. Chan. I would first like to give a thank you to Papa Jack, who recently passed away. Without any of his support in establishing the K Fellowship, none of this would have been possible. His contributions to helping incite innovation within the school helps build a bright future for generations to come. Firstly, I will be giving an introduction to chronic wounds. Then I will talk about how AI has been used in medicine and recently with skin cancer. I will then discuss my hypothesis, which is the use of a convolutional neural network to classify wounds. I will then discuss my results, the accuracy, and then give a summary of my future plans regarding this project. Chronic ulcers are a major problem within our current healthcare system. Chronic ulcers are a type of skin condition where skin on the epidermal layer breaks down, exposing raw underlying fat or muscle. The most common locations where these ulcers can occur are in the feet, lower legs, and the sacral region. Chronic wounds, which occur more in elderly patients, often lead to lots of pain, and in some extreme cases, infectivity and death. In addition, around 15% of Medicare patients have had some sort of exposure to chronic wounds within their lifetime. In addition, elderly who have health complications such as diabetes and obesity have been proven to be more susceptible to chronic wounds, creating a clear problem of managing how to deal with these conditions. Here we have two different images of chronic ulcers. The one on the left is clearly non-infected due to how there are no discolored debris around the wound, in addition to the color indication of dark red skin indicating the wound is not infected. The picture on the right is clearly infected due to how it has greenish yellow debris surrounding the wound, and there is little to no healthy dark red tissue around. As stated previously, many of these patients that have ulcers are elderly and live in nursing homes. The current state of medical economics suggests that as doctors and nurses become more scarce, it creates a bigger need for some sort of way to alleviate pressure from doctors. However, currently with patients expecting long wait times for the treatment of their wounds, infection and hospitalization are becoming more frequent. AI could be very helpful to doctors. Research in the field of skin cancer has already shown that some types of AI are able to achieve similar or higher accuracy when compared to a doctor. In addition, AI programs such as convolutional neural networks have proven to be especially effective in imaging-based problems. This is why I picked chronic ulcers, as often the first diagnosis is made using a doctor's vision, and then it is sometimes double-checked via a biopsy. The nature of chronic ulcers suggests that using AI to identify them could be very effective. My hypothesis is that through the use of a convolutional neural network, an AI could be developed that would be able to effectively diagnose and classify infected versus non-infected chronic wounds. For any AI, there needs to be some sort of data set to input data to help generate an algorithm. The data set used was compiled by myself and my mentors. We gathered images using a combination of online databases and databases provided by the Palo Alto Medical Foundation in California. Two separate folders were created, each with around 100+ images of either infected or non-infected ulcers. Due to the scarcity of ulcer data sets, this was compiled by hand, and I'm currently working on collaborating with the Wound Care Center to acquire more images for a bigger data set. When building the AI, I used a convolutional neural network using Keras and TensorFlow, which are both libraries in the Python language. A convolutional neural network is a type of model for an AI that allows the computer to analyze each pixel for an image and analyze images using the RGB color. It then passes each image through a system of layers, which stores data for each image that is then used in an algorithm to make an analysis of testing images. Along with the CNN, I also implemented many data augmentation techniques, such as grayscaling, which turns all the images to black and white to help prevent AI bias. In addition, I also changed the pixel ratio of my images to make it easier for the AI to process the images. In addition, cropping images help make sure my AI was only analyzing the ulcer and surrounding tissue. For the grayscaling, this is the main aspect implemented into AI to help prevent bias with skin color, as all the images are black and white. However, this process of turning all the images to black and white also reduces the amount of data which could affect the accuracy of the model. I first learned how to build an AI using Google Colab. I used a practice skin cancer dataset to get familiar with how AI works. Once I began working on my project, I experimented using PyCharm. How after running into some difficulty, I switched to Jupyter Notebooks and completed my project on Jupyter Notebooks. Jupyter Notebooks allows you to individually run cells of code, and also it's more based on your computer, whereas Google Colab is a cloud-based coding service. Optimizers are something that are common in AI to improve the accuracy and efficiency of a model. I experimented with some optimizers such as RMSProp and Sigmoid. However, I eventually chose ADAM as my optimizer, which combines elements from both RMSProp and Sigmoid. In addition, ADAM also gave me the best results for my project. After completing this project using my existing dataset of around 200 images, I was able to get a training accuracy of 92.785% and a validation accuracy of 88.996%. I ran this project for 30 epochs with a learning rate of 0.001. The epochs determines how many times the AI will pass the dataset through the algorithm. Passing it through more epochs increases the accuracy. However, doing it too much can cause overfitting. The learning rate determines at what rate the AI will attempt to change the algorithm based on an incorrect result. The training accuracy being higher than the validation accuracy does show some overfitting within the model. And overfitting is basically when the AI tries to memorize the data set instead of trying to learn what the characteristics are for each image and how that affects the label. The best way to combat overfitting is to either change your code or expand the amount of images. This allows for the AI to have access to more data, which would boost the accuracy. In summary, it has been proven in early data imaging trials that AI could be very helpful in providing medical assistance to doctors. Even with some skin cancer projects, AI has been proven to be able to reach the accuracy of doctors and sometimes overtake them. As we enter a new era where the demand of doctors has exceeded the supply, AI could be a viable option to reduce this lack of supply. In addition, for chronic ulcers, most of the diagnosis is often made by an eye assessment, and a convolutional neural network, which has been proven to be exceptionally effective with image recognition, could prove to be able to provide similar care that a real doctor would. When improving the AI, I would first attempt to either add more layers or to have checks, or I also wanted to attempt transfer learning, which involves taking a separate algorithm and using it with your own model. Basically, for transfer learning for me, I would attempt to take a perfected algorithm from a skin cancer data set and modify it to apply to chronic ulcers and then apply that to my own project. In addition, the best way which I see is that I could expand the number of images as 200 images is simply not enough. And for these neural networks, you typically need thousands of images in order to get an accuracy that is reasonable. Overall, doing this project taught me so much about how AI works and how AI is becoming a dominant part of our everyday lives. I learned a lot about how to code neural networks and how they work in general. In addition, on the medical aspect, I also learned a lot about chronic ulcers and how they affect millions of people worldwide. If I had additional time, I would like to increase the size of my model and add more images, preferably thousands. In addition, this project also taught me a lot about perseverance, as when I first began collecting data in June, I found it very difficult to learn all the code regarding this project. In addition, my future advice to anyone planning on doing a K fellowship is to always ask for help whenever you get stuck on something, as if you don't, you are only hurting yourself, and that most of the time, asking for help can help you better understand what you do not know. I would like to say thank you to both of my mentors, Dr. Delahanty and Dr. Gupta, for helping me learn how to code in AI in general. Also to Dr. Chan, who kept me on track throughout the summer, and to the Inspirit AI team for helping me get jump started with this project. Thank you, and I'll now take any questions.